Sorry.
Hey, good to see you. Welcome and thank you for joining us today. I really appreciate it.
Oh, it's my honor. Thanks for having me.
Yeah,
Linda and
yeah.
Albert, it's great to see you guys too.
Good.
Ignore my Slack message, sorry.
That's fine.
I
Okay,
was just getting off another call, so.
Yeah. Okay, we are live. Welcome to Plan C Live. Today we have the organizers of GetUsPPE.org and also FindTheMasks.org and .com rather, and FindTheMakers.com. We're going to be talking about that too. I'm Dr. Megan Rainey is joining us from the Boston area, I believe, and we have Linda Yang from Vancouver and Albert Wong from where'd you say? Oh, Seattle, right? Okay, and Dorothy's from the DC area, Dorothy Jones Davis. Dorothy, welcome and congratulations on NomCon and a good.
It was great.
Any reflections on?
It was just an amazing event,
and also bringing the community together to talk about what they're doing.
Yeah, so we had 4 days of dialogue. It was really amazing. Over 370 different maker leaders from around the country and the world, I think, that joined us. So it was really nice to see something that is so memorable in person turn into something virtual. I know you share that sentiment with virtually Maker Faire. It's kind of interesting to watch how our world had to change briefly. But we had a lot of really amazing dialogue about what's going on. Lots of talk about the efforts of organizations like FindTheMasks and GetUsPPE that are doing really amazing work to get PPE to the people that need it. Some dialogue about what's going on in our country right now, and just it was really exciting. So I'm excited to see where our community goes coming forward, for the next few weeks. So I think there'll be a lot more to continue to talk about.
Good, thank you. I do think it is good for people to connect however we can. It does not only show support for a common effort, but we all learn from each other, and that's really important. So in many ways, both groups here are about connecting, in some ways, the producers of potentially of PPE and the users of it. And it's I think it's a really great story we've seen of makers responding to the needs in their community and the expression of those needs from those who sometimes work within large systems that aren't used to this. So I might start with Dr. Rainey and ask, kind of how this started in your mind. How you're a physician, emergency room physician. You're also a professor at Brown. So you teach it, you're in the middle of it. But how did this get on your radar, and how did you say we needed to do something?
Yeah, so Dale, thank you so much for having me. It's just such an honor to be here with you and Dorothy, and of course with Linda and Albert too. So the PPE needs really came onto the radar of public health professionals and medical professionals relatively early on. When we first saw the reports of this novel coronavirus coming out of China, we knew that if it came to the United States, we would need huge supplies of personal protective equipment, masks, gowns, gloves. In fact, many of us, including my own hospital, had stores that we had created in prior outbreaks like H1N1 and SARS and Ebola. So as the reports came out, many of us started mobilizing our existing supplies and trying to get more. And as January and February went on, we found it increasingly difficult to access new supplies. And then mid to late February, of course, when we first saw cases here in the United States, our first case in Rhode Island was one of the earlier cases diagnosed in the nation. It was someone who'd caught it in Italy and brought it back. There started to be this alarm level among medical professionals. And that was the point where I wrote a piece in the New England Journal of Medicine talking about the need for a coordinated system to produce and distribute PPE. And then from there, the rest is kind of history, where many of us, as we started kind of raising this alarm, began to join together either on social media or through our various groups and to create collaboratives to try to fill the gaps that were left by the existing production and distribution systems.
What was your initial thought? Like, where would the PPE come from? I mean, I don't know that did you know about the maker community, or was that an option at the time you were putting this
That's a
together?
great, yeah, no, it was not, it honestly was not on my radar early on as a medical professional who, and I will start with a caveat that I don't normally work in the supply chain. I'm a public
Yeah.
health professor. I do a lot of work with technology, but I normally don't touch the supply chain. I just say, well, someone in my hospital places orders and PPE arrives, and that's all I have to think about. Started digging in, I thought, well, we can just increase manufacturing or increase imports. And then in those first weeks of March, that was when I saw the maker community starting to step up. And I'll be honest, in the medical community, we had these early discussions about, well, you know, what about the made PPE? How we know that there are manufacturing standards. How do we don't want to put people at risk? And so it was a learning curve for us, and has been one of the most exciting areas that I've learned about over the past few months, is about the way that the maker community works, the various types of makers that there are and maker spaces, ranging from the, you know, homegrown Auntie Soy Brigade to the very formalized maker spaces, and the wide variety of different products that you all can produce, and the degree to which you really are filling this need with American-made protective equipment. It's just been lovely.
Yeah. And one of the big things we saw, like in rural communities and areas where they were really concerned about knowing if they would ever, you know, they're in line behind large cities often. And so having this really distributed production capacity can make a big difference. So we're kind of, for those of us from the community, thinking this is almost what the community was designed to do. It was, people were trained to do this, but I think they had to actually learn to work together on a common problem. And then even finding out, even if they could produce PPE, how do they get it in the hands of healthcare professionals? And that's that. Some had to be really clever and go around the system. Others found a person or found a contact. But can you talk about from the, I guess, the healthcare system's point of view? I mean, you know, we certainly heard points of view, hey, we will never use this, and then that changes a week later because they realize the situation they're in. It's a very big change, I think, that had to happen.
So I think from the healthcare system point of view, absolutely, there were a couple of big changes. So one is us moving from saying we will only use things that are FDA or NIOSH approved, period. And we saw that in multiple areas. We changed all of our standards around the use of protective equipment. If you had told me in January that I was going to be told to send my N95 respirators off for sterilization, that I was expected to keep reusing them until they no longer fit, I would have said, you're kidding me. You know, I throw out my N95 every time I walk out of a patient's room. So we changed everything about our standards. I think part of it was having those NIH approved designs was a really big moment, as well as some studies that some in the makers community have done, looking at the efficacy of fabric masks, particularly the 2-ply and certain types of fabric, that made a big difference in terms of trust. I think part of it, again, though, was that we said, well, there are alternatives, and we might as well work with you and try this. And then finding that, honestly, for many of my nurses, you know, the homemade masks or the made masks, right? Because as I've learned, there's two parts to the makers community, and the face shields are just as good, if not better, in some settings, and are sometimes more comfortable. And there's an ability to personalize them, which, if we're wearing masks all day, it sure is nice to have a mask that, you know, has flowers on it or Disney or whatever, rather than it just being the standard blue. Many of my nurses are actually wearing the made masks, as are some of my physicians, on the outside of their kind of surgical masks or N95s.
Mm-hmm. I think one of the beautiful things I saw was actually, it seemed to me that healthcare professionals appreciated the chance to give feedback on designs, and makers appreciated getting it so that they could improve it. And that's normally doesn't happen in a large manufacturing system, totally. Especially when it's done offshore.
I think Oh,
Oh, go
sorry.
ahead, Dorothy. Sorry.
No, I was just going to say one of the things that's really remarkable too is I think how many physicians became makers, or I mean, it was latent inside of them, right? Like they were always makers, but there are a number of physicians that I met, or individuals within the healthcare system that were like, oh, I have an idea for something. Can you try this? Can you prototype this? What if we change it this way? Can you do something to change it this way? And I don't know, that brings me a little bit of joy too, that there's a conversation happening between two communities that may not normally communicate with one another on the day-to-day.
So that was actually exactly what I was going to say, which was one of the coolest things about this was watching people work together. So for instance, I have a plastic surgeon who has a 3D printer that he uses to make craniofacial models for like how he's going to do reconstructions. And he said, well, who can I work with to make face shields, right? And so watching that back and forth happen, I think was one of the neatest things, because a lot of people in healthcare were kind of MacGyvers and makers out of necessity in our daily work. And it was really neat to watch that exchange happen and watch us create new forms of knowledge and new partnerships. So Dorothy, reading my mind.
Now that and what we'd love to see is have them talk about it a little bit more, because often they do that MacGyvering. I'm not going to tell anybody, but it really is innovation. It really is creative problem solving, and it happens all the time. But it's often not so visible to others and recognized as being valuable.
Totally.
Yeah,
that's the opportunity. I mean, I think people have asked me, what good has come out of COVID-19? And there's obviously an awful lot of bad, but to me, one of the big good things is watching these new communities come together, or people from different communities join together and create new ways of solving old problems.
Right.
And the hope that gives me about our ability to move forwards together and to create new ways of being in this new normal that we're facing.
Right. Can you talk a little bit about, here's the U.S. context, and what about the rest of the world, and does GetUsPPE engage other countries and other countries in the world?
So we do work with folks in India. We've provided kind of our basic structure to people in other countries as well, but we are primarily focused on the U.S. We haven't filled the need here yet. We continue, as Dorothy knows well, we continue to kind of work incredibly closely with the makers in terms of filling needs, providing grants, assessing where there's new need. But then we can't fill it here yet. And so it would feel irresponsible to me to say, well, we're going to go elsewhere. That said, certainly there is rising need elsewhere. And it's tough to assess as part. I mean, so my sister is a physician in Switzerland, and they actually used makers to make gowns for her clinic, because they completely ran out of isolation gowns months before we did here in the States. And so worked with basically a sewing brigade in her town to create gowns for her clinic. So I think there's a lot of potential there, but for GetUsPPE, at least, we are mostly US focused.
Yeah. Well, let me invite Linda and Albert to join us here. And first of all, I guess there's this, the story of FindTheMasks.com, but with a little prompting from Dorothy. Linda, you're a maker, and you got involved in this a bit because of your background. Can you tell us about yourself?
Yeah, so my day job is actually in life sciences. And for me, how I even got into the PPE kind of world was because back in January, February, in the research labs, we were already being solicited for our protective equipment, because we wear similar gloves, surgical masks, and in some laboratories, we also have the face shields. And so our local hospitals were saying, like, our supply is running really low, and through traditional supply chain, we're not able to secure anymore the volume that we're anticipating. Can you guys donate some of your surplus items, knowing that university campuses were being closed to students, graduate students, etc.? So at that time, I was in the US and I had to come home to Canada actually due to COVID-19. And so I felt like I need to do something. Most of the people I went to school with during university, they went down Megan's track and became physicians and other type of clinicians. So the people I think about are the ones that are my friends, my classmates that unfortunately I've lost touch with over this decade and a half, but I know they're out there working those medical front lines. So I came prepared with a bit of show and tell.
Great.
With your point about iteration, I mean, likewise, to Megan's point, I never thought I would ever get involved with any sort of supply chain in a lab as well. Someone else does the ordering, you just use it. And so it's been really cool to work with local hospital systems who we give them a design. They try it out usually through their occupational health and safety department. We get even feedback from COVID positive units and non-COVID units to see how the staff like them. And so, for example, one thing that my family and I make, we make these things, ear savers.
Yes.
And the awesome thing when it's maker made is you can get away with these colorful, vibrant colors that, you know, a manufacturer just probably isn't going to do. They'll do black, white, gray, something more sterile and professional probably looking. But this is already our version 4. It's been mutually iterated from the medical community as well as the maker group that I work with here in British Columbia, Canada. And to your guys' earlier points, one beautiful thing has been you can be anyone and also be a maker. I think that's been one of the awesome things that really bring together this sense of community within a geographical community, an ethnic community, a trades community, but it's also cross-border. We send our stuff all across Canada. I invoke other maker groups that I've met through FindTheMasks, FindTheMakers, and elsewhere to help me out when I get a really big order on the West Coast that I can't fill by myself. And we also work across that 49th parallel between US and Canada. There's also groups who can ship across that border. And it's been a really heartwarming kind of one silver lining of all of this.
Yeah, it really is. Albert, could you tell us a little bit about how FindTheMask got started?
Oh, it's a pretty simple story. Like Rachel, the founder,
Rachel Popkin.
Rachel Popkin, they have friends in the medical community. And one of the things the ICU nurses that they knew sent a message saying, I can't work because I don't have N95s. And Rachel threw together a fast website because Rachel and I, we both work in tech in our day jobs, and it was easy. So then they popped out to me and said, hey, can you help make this site more efficient? So we spun it up, and that was sort of the founding. Was basically the idea was it was at that really busy time at the beginning of this sort of COVID situation when lots of people knew there was need and there was like no information database that could make it centralized, and everyone was like, there's 20 of these, how do we do anything? So we just started spinning up a fast repository. Information eventually got to be a map, and that's sort of the genesis.
Right. Could you talk, either of you, on how, I kind of get the idea of institutions sort of assessing their need and saying, we need 1,000, face shields or something like that. And then the idea is that there's people out in the community that may be able to produce 10. And you're kind of, are you aggregating those or just putting them in touch? It's almost like putting an order out to a production group and try to get to that 1,000.
I think there's a few aspects to this. So I think, this is an interesting thing, as people are saying, it changes every couple of weeks. Yeah. Really, actually, probably every couple of days, more realistically. And I think very early on, that was a major concern. At this point, at least, and I think everyone has a different perspective, but my head on this is, in a sense, like the equity and problems you can see are only the visible ones. And one of the beauties of this makerspace community is that, we put data out there and people self-organize to actually make these deliveries, maybe in quantities of 10, maybe in thousands, we don't really know, but they will know. And in a sense, if we track, it might, we'll essentially track all that. So there's multiple prongs. There is sort of the baseline, get the data out there and get people moving, get it happening, move how much we want, spur other organizations that can move their own numbers. And then on top of that, we have value add services that I think Meg can actually probably talk more to about actually trying to do more direct matching, more intentional matching.
Yeah.
And there's a nuance before, I want to make sure that it is clear there is a little nuance. And I think we need both approaches, right? So there's the nuance of having publicly available data that allows people to sort of make their own decisions and see the ecosystem around them. I think one of the things that's really beautiful is that the work, although it is very global in nature, as Linda pointed out, that people are working together, it's really, really local, right? People first, and I mean, this is how we all react, right? Like, how can I help my neighbors? How can I help my family that might be close to me? How can I help the people that I love the most in the world, which tend to be in our local communities? And so having the data out there publicly, like, FindTheMask has a very public, data list that also GetUsPPE also uses. There is a collaboration that's there too. That displays, where people can just find organizations within their community that have need, and they may or may not be just healthcare facilities. So for FindTheMask, there's expansion to beyond healthcare facilities, which is really great. And then you have GetUsPPE that has a different complementary approach, which is really almost a bespoke matching, right? So if you have, some need that's reported and, maybe is not public, or maybe somebody needs assistance with figuring out how do I best do this? You can also implement things like an equity algorithm, or having some sort of fairness approach. We keep changing the name, so I'm not sure what the new name is, Megan. I'm so sorry. But there are other approaches, right, to making those matches between the groups. And I think that we need to do both, right? Because there are people that self-organize, but even our self-organization, it occurred to me, especially this week in light of everything, that there is bias, right? And that sometimes we need to help a little bit to make sure that bias doesn't persist. So I don't know, Megan, I'm sorry, I didn't mean to cut you off there.
Dorothy, you never cut me off. Thank you. Yes. I mean, I think that was one of the driving factors actually behind the creation of GetUsPPE, was as I was kind of going on social media or on TV talking about the need for PPE, my own hospital was getting all these offers of donations, and it felt really unfair. I work in public health. Like, I'm aware that I am here in kind of a very Ivy League institution that has, we didn't have excessive PPE, but we have some resources, and it felt really unfair that I was getting it, but my colleagues who work at safety net hospitals in Detroit, or who are part of the Indian Health Service, were not able to access PPE. And so that really was one of our driving forces. And I think one of the other things that has been interesting is seeing, again, these differences where some of the made supplies that we have helped match or distribute have been these large volumes, of face shields or gowns or masks. And then thinking through kind of how do you distribute those? You don't necessarily, going off of Dorothy's point, want to send them all to a single hospital system, although they may all be needed by that hospital system. Is it better? And it's really it's not an easy thing to answer. Is it better to send it all one place, or to send it all a lot of places, to divide it up into smaller orders? The other thing that I'll highlight there, and a more recent, going off of Albert's stuff keeps changing week by week, is that we have done a lot of work in the past week and a half with providing made masks to protesters, with the goal of keeping them safe, and it just being a really nice intersection. I look at the maker community as being a great example of a non-hierarchical, equity-based community. And so both supporting makers and supporting protesters who are out there fighting for the same vision of a different America has been just really meaningful, and not something we would have expected to be doing if you had talked to me. So
well, it is amazing. I mean, it's like 90 days or something that all this has happened in, and none of us at the beginning of the year would have predicted that we would have spent March to June doing these things. But I'm kind of curious, if I might ask, on the distribution, if you want to say algorithm or however, is that being decided by people or computers? Like how, like when you say, I'm going to take a big order and divide it up. Is that
so
people?
Right now for us, it's a combination of the two. We have a couple of folks that we've worked with from a couple of large kind of engineering computer science programs at large institutions who have helped create some algorithms for matching based off of distance and need, but there's also a very human element to it. The goal would be to get to a point where it's automated, but right now that feels So there's so many subjective factors.
Well, exactly. I mean, I think a lot of things, they're very hard to automate. Maybe they shouldn't be. But it kind of leads me to a little bit down the road of post PPE production and things of, if we just take this idea of distribution and say, we were to look at communities and say, why are some communities missing things that other communities have? Our approach has been, well, the market levels that all off, or whatever we say about that. But you're kind of building tools where we could rethink that kind of distribution system and say, well, we could bring on more producers, and we could find, a way to distribute that more efficiently than perhaps even the market does it.
Yep. That is one of our favorite topics of conversation on a high level, where we don't have answers yet, but would love to get there. And there's this constant balance between the service mission that I think all of us feel, which is getting PPE in the hands of frontline healthcare providers, and that larger, where does this go next? What does this mean for the world? 4 months ago, I wrote a piece that got published in a journal asking for someone to create an algorithm to distribute things equitably, not based off of political favors or friendships. Maybe it's up to all of us to create that.
Yeah, that's a real interesting. So let me ask you though, because I think we're at this moment after this 90 days where we're kind of wondering, does this just go on, much longer or not? Does it stop? And if it does stop, what are we going to do in its place? And I think we're all trying to figure. It's not that we're out of it by any means, right? But I was talking to a group in France, and they're, the maker spaces are beginning to go back to be open again, and some of the people have to go back to work or other things that they were doing. So there's some transition period here that's happening, in which we have to still deal with the present, but we have to think a little bit about the future.
So, I mean, I've sort of in my history been involved with the sort of rapid response on the technical side a few times, and an interesting thing I've noticed, I think sort of applicable here, is what someone was saying earlier, is you have these cross minglings of communities that occur. And what I've noticed is that basically, we all did a thing. It's going to happen. And it all sort of ramps down at some point. Then about 3 to 4 months from now, these groups sort of splinter off and re-gel, and they start doing more interesting things. And they solve these sort of like problems you're talking about, local distribution in a creative way, in a way you can't sort of imagine initially. And I sort of think that as you watch this going forward, what you're going to see is that these groups are going to splinter and reform.
Yeah.
And then they'll actually solve the problem you're talking about in a way that we probably can't imagine initially. They'll probably be awesome.
Yeah, like a seeding, right? It's a seeding of, groups. And I think we probably do our most rich seeding during these crisis periods, right? Because we're forced. I mean, I think the thing is, you didn't have the luxury, like in crisis, you don't really have the luxury to sit and think probably some of the divisive thoughts that we generally think about each other. It's like, who's willing to help? And you're not questioning where they came from or what their pedigree was or anything like that. Like, to be honest, I became friends in a very short time with a bunch of people that I've only known for, on paper for less than a month, right? And I'd die for some of you guys now and again, but I mean, seriously, like, I feel like I'd give, if you needed my kidney, you got it.
Okay.
But I think the reality is that that's the case, because when we're in this sort of crisis period, you build these, trust comes from sort of being in the fire together, right? And I think we're all in the fire together, and that's what you see. So
I also think that people have wanted to do something too, right? And I hope that doesn't go away. In other words, there's a real need here. And when you kind of see that need and you think, I've got to do something, that's a great thing. It changes lives, I think, to do that. And I think the sense of, oh, well, we don't need PPE anymore. Well, we still need other things. And I think this transition is going to be very interesting to try to move from maybe a narrow catalog of objects to a bunch of other things. But Linda, I was going to invite you to comment on the topic.
Yeah, absolutely. I feel that it's definitely not that we don't need PPE anymore. It's that the need for PPE is changing.
Yeah.
For example, Albert and I, we both have spent years in our working lives in East Asia. In that part of the world, pre-COVID, it's already extremely normal to wear face masks, surgical masks in public for a slew of reasons, from everything from allergies to you just had a late night with colleagues, maybe at the bar last night, and you want to maintain some professionalism at work.
I
That
didn't
is
hear
all
that one.
acceptable. But we don't really have this cultural practice in North American society. But now, whether it is a local mask law or just to conduct daily business, to go to the grocery store or bank, for at least in Canada, many places require you to show up in line with a face covering, or you will not be allowed to buy groceries in that transaction or do banking. So we will have a societal based need beyond just healthcare and other front lines that may not need to be medical grade, but we still need massive supply. And that is a beautiful place where I think Maker made items can come in.
Okay, great. Right.
And I just want to highlight there that, this may not be in the news as much anymore, but the problem, just to kind of put a pin on that, what Linda said, that the problem is still there. And as we reopen, the need for PPE actually expands, because now we're not just talking about hospital workers. And I know, Albert and Linda, that you guys have moved into this, but we're not talking about just hospital workers or nursing home workers. We're talking about grocery store workers and pharmacists and people that work in barbershops and people that work on mass transit, and it expands outwards. And so the role of makers there becomes ever more important.
Yeah. It's interesting. I mean, obviously there is some distinction between sort of clinical use and community use that even the NIH exchange, but in some ways, it would be good if even community use got to be closer to clinical use, not just a scarf, but something that seemed to protect you. And I think that's an area where it would be, I guess at least there's sort of a question that as the maker community got involved in this, many of them were looking for specifications. Like, well, what works? What is needed? What qualifies? What passes this standard? And it often wasn't very clear what, and some had to do their own versions of testing to figure out the quality of materials and various things. But I think this is a big place where open source could play a role, or at least the idea of it, of these specifications being open, being established and supported by healthcare organizations, and saying, well, if it meets this, it doesn't, and again, you have to prove these things out, but we've kind of built a system that has a few players, and they kind of control a lot in it. And I think this is a question of opening it up more and allowing other people to make it for maybe completely different reasons than what the market normally makes things for.
Yeah, but I think, the open source world is growing in that respect. And I mean, you look at the open source medical supplies group and their guidelines now, and, they actually have a medical team that evaluates and does look and give feedback on the different designs. And I'm always just struck by the actual innovation. The other day I was just talking to Make Haven, which is, as you know, Dale, a makerspace in New Haven, Connecticut, and they have some designs for, masks for cloth masks for hard of hearing and deaf individuals, which is the one with the clear piece. And, and that's, I think that was a direct innovation. Like, nobody had been thinking about that. I don't think that was something that had come up. It came out of a need that the community had given to makers and said, like, how can we make this work for our community? We still need to be able to communicate, but we do need to be protected. How can we fix this? And some makers said, let's try this and let's try that. And now there's a bunch of iterations on that. And I think, that's really the beauty. And I think part of one of the things, I know you're going to get there. I would love to hear from Linda and Albert a little bit about the FindTheMakers project, because I think one of the things that we were hoping for as Nation of Makers in that project is really looking at how do you visualize where the makers are and who's doing what in a way that allows them to also help with that innovation and that cross-pollination of ideas and rapid iteration.
Mm-hmm. Yeah, to Dorothy's point about cross-pollination, I mean, just some context about the makerspace that existed pre-COVID. I think they kind of exist in two silos based on, well, materials, but also gender. So then there's the plastics who lean towards being male dominated. And then there's all the textile groups who do the homemade masks that are, as Megan mentioned, sometimes like an anti-sewer group on Facebook, but they're very, very active. And these two groups prior to COVID weren't really cross-talking because they're not really making the same thing. But under the category or umbrella of PPE, they can really come together. And with our partnership with Nation of Makers, that was one of the priorities. Like, how can we equally really showcase these two very large groups who are both very necessary to help in the PPE space?
Right. Linda, could you explain just a little bit the FindTheMakers.com versus FindTheMasks.com?
So FindTheMask it started in the US and was a nationwide PPE needs map. So every pin you see on that interactive map is a facility that is in need of PPE. Whereas FindTheMakers, what we're actually pinning is anything from maker spaces, maker groups, and also pivoted manufacturers, because a lot of people have also reprogrammed and retooled their existing assembly lines into the PPE needs space as well. So we have avoided actually on the Find the Makers to pin individuals, because we're hoping that individual makers and SOAS can find groups or spaces in their communities that they can link up with and do some of these more sophisticated things that we have been talking about. For example, even the ear savers I showed you guys in week 1, this is my grandmother's house. We print downstairs with one 3D printer that randomly my little cousin had because he's an undergraduate in engineering and needed it for a school project. We would just ask in advance whether the hospital would accept them, and they would. Now in kind of like week 10 of this, we work with a larger group that we found in our community, and we send them all to a central place where they get sterilized. That would have never been an option for an individual maker like me. So with maps like that, you can unlock different resources in your society that are maybe available, but you yourself have no access to or knowledge about.
Yeah. Let me ask you a question about how, I think you just drew a pretty good picture of how the makers begin to connect to new services and connections form. But how do your groups work together? Like all of a sudden, in these 90 days, we have all these new groups like GetUsPPE and Find the Mask and Open Source Medical Supplies. Nation of Makers preceded this, but like all of a sudden you have this sort of organizational collaboration that's required as well. What's that been like, Megan?
I think one thing is, so neither FindTheMasks nor GetUsPPE existed at all before about 90 days ago. So a lot of this was kind of a lot of different groups kind of coming together. And as you've already described, kind of coming together, realizing there are slightly different missions, pulling apart, reconnecting in different ways. And we've watched that happen between FindTheMasks and GetUsPPE. We've had it happen between GetUsPPE and Project N95, which is not a maker focused group. It's really a manufactured supply focused group. But we've talked to, we've worked with other maker groups like GetPPE, which is a SOIST group as well. Obviously, Nation of Makers. It's this constant iteration, right? As the problem evolves and as our organizations evolve, figuring out what the right way to work together is and creating terms of engagement that feel aligned with all of our values and missions and time. Because also recognizing that for most of us, this is not our job, right? This is a on the side thing that we did because we felt called to do something. But we have to figure out ways to, I think that one of the best things that we all do is to amplify each other's work and not duplicate each other's work so that we can be as efficient as possible, given that so many of us are volunteers.
Yeah. Any of you others? Dorothy, you've been in the middle of a lot of connecting here. That's kind of what your specialty is. But but it's kind of, isn't it kind of hard? I mean, you have new groups, new people, not necessarily in formal roles, and they're moving and changing week to week.
I think it's a little bit of acknowledging too where people's like wheelhouse is, right? So I think some of it is not to be literal to the Find the Mask folks with mapping, but like mapping out the landscape, right? So I think the reality is there is an enormous job to be done, right? To fulfill PPE. When the CDC made the recommendation that all Americans should wear a mask, I mean, all the makers were like, oh my God, we have to make how many billions of masks now? Like, people were already super fatigued and tired. And, I think people wanted to do what was right, but they were like, oh my gosh, how are we going to continue on? And I think figuring out a way to help to kind of continue to broaden the work that we have to do, and knowing that it's beyond this 90 days, right, requires us to really think about, okay, what are our strengths and what makes sense for us to do. I think one thing Megan said that is a decision, and it may change. I don't know, everything changes every day, right, as you said, but like right now GetUsPPE is very focused on the United States with a little bit of engagement internationally, but most of the focus is in the United States at the moment. And that, is okay, because there's enough need everywhere in the United States still that if GetUsPPE works only on the United States all of the time, unfortunately, I mean, we probably don't want to think this, but we may not still meet all of the need, right? And so, it's important, same with FindTheMasks, every facility that keeps putting themselves on the map, and we still do get new facilities over at FindTheMasks, right, that keep putting themselves on the map and saying we still have need, this is evolving constantly. There's tons of work for all of us to do, so it makes sense for us to try to do it together, to deduplicate efforts where possible, and just really try to help uplift each other so that we can continue to strengthen one another. So I mean, as you know, I'm a connector, so I always want to bring all the people that I think are amazing together.
I do hope. Yeah, Albert.
Yeah, I just so I mean, again, I've sort of, like, the way I look at this, and I've seen this a few times on this stuff, is everyone energizes really fast storms, right? And we all sort of try to glob together and then eventually sort of break apart and specialize and reglob. And I think what's sort of interesting when you asked about how do you communicate and how do you coordinate when there's like a new group spinning up every couple of days in their area, what I've noticed, what we've done a lot of is actually a lot of hyper communication. Slack has been extremely a blessing and a curse. I love that system and I hate that system. And that's sort of like, getting chatter, building trust between people so that things can happen is sort of really big. And then sort of understanding when generations shift and when economic shift, and watching orgs move is sort of a big thing. But if you want to coordinate, and what's happened at this point, I feel like, is different orgs have sort of moved into different sections of the ecosystem. So there's sort of infrastructure orgs, there's sort of ones doing bespoke services, just one having regionals. And as long as we can stay light touch, it kind of just works out, because most humans are generally good humans. And if anyone actually came to work on this at any point in the last 3 months, rather than just hunkering in their home, they're a good human, like, no questions.
Yeah. But I guess we'll move on from this in a moment, but I'd love for you to think about, not just for today, how our institutions could absorb some of this capacity, how they could think and act this way. It seems remarkable that you can build organizations, put people up, and again, I think in some of these groups, they were attracting people who have day jobs in big organizations, but weren't doing anything to solve these problems. And people said, I want to be part of, a group that's helping to solve this. So it attracted a lot of talented people with different skill sets, some with, general skills that were able to figure out things. So, but I kind of wish part of this is our government was more responsive like this, that our institutions could deal with this. So I'm going to sort of throw it into maybe our final segment here, which is kind of the events of the last week, which, we were already in a pandemic, and now we're adding to that with, we're discovering, I guess, new issues and seeing the impact there. But, it did, at least for me, it didn't make me stop or pause and say, I thought we were making progress here on things like PPE, but no, there's this whole other thing we need to think about and deal with. And how did that manifest itself in your lives or in your groups? And you already mentioned, Megan, making masks available to protesters is a pretty good example. But it is a pretty remarkable series of events over the last week.
Yeah, I think.
Go ahead,
Oh,
Linda.
you go first. No. I mean, on a more comedy note into a serious topic, one of my younger students mentioned she's glad she's done high school, because imagine the high school seniors who have to study for a history final in about 15 or 17 years, and the year 2020 will be so hard to parse and tease apart everything that happened seemingly in succession and overlap and concurrently. And I think to Megan's earlier point, it was really wonderful that earlier in the year, across the world, we were all focused on kind of one global issue, the global pandemic. But I think the events over the last week and a half, 2 weeks, remind us that, unfortunately, we don't just get dealt one problem card at a time that we all get to focus on. And there are other issues across society that we need to take care of as well.
Yeah. I mean, but you wrote like your group in particular had some meetings and talked it through, and you thought it was overall fairly positive, the conversations you were having within your group of volunteers.
Yeah, definitely. I think because our group of volunteers international, as you can imagine, they see the world through various lenses that are colored by their culture, religion, and passports. And so what we all thought about, the events over the last 2 weeks, they're on a spectrum, but the wonderful thing that through these conversations, we realized, to Albert's point, we're all good humans. And at some point, we know how much we should, put on the line our personal views, but also within our group, it's still really about PPE needs. We did consider, for example, reaching out to protest groups and just talking about what really is necessary here. How can we help the most amount of people and do the most good? That's always kind of been our internal standard, and trying to meet that.
Mm-hmm. I could follow up and just add one little piece of color. I think this is sort of really specifically interesting to makers. Back to all the sort of makers are sort of local communities in a strange way. It's sort of new to the world right now, new as in the last couple 100 years kind of thing. And they know their needs best. And we've had to sort of when you think about PPE, everyone thinks N95 masks. You do not need an N95 mask to go to a protest, right? And so the variety in the long tail of needs, both in terms of who needs it and the types of PPE that are sufficient for the situation you're entering, is totally different. And it's a way that, because as you talk about innovation, people I think the maker orgs are sort of amazingly apt at both sensing the need and responding fast to it and fulfilling it in a way that frankly, I kind of want to be out of their way. Give the information and don't get in the center, because I will slow any centralized system will slow that down.
Yeah. And
that's where I think the events of the last week have made me think sort of how important it is to beef up the sort of knowledge that we locally can fulfill our own needs, geographically locally, because these people have these talents all over the place and these materials that we didn't know before. That's
a great comment. This is the thing that I find so remarkable in the stories of the different groups, is how they found people, how people stepped up, who may have had a background or skills in doing it, they may not have. They just recognize the need, and it really is an opportunity. That's why I wish, to some degree, there was broader support in our institutions for this, because it is seeing the potential in so many more people than we do. So I think that's a really good comment. Megan, you were going to say something earlier.
No, I mean, I think Linda and Albert have said so much already. I think the one thing that I would add is that we're having a lot of conversations already among our groups about how to do this work in a way that felt equitable. And one of the things that I've been so impressed by all of our groups over the past 3 months is the degree to which we act in addition to opining. Yes. And I think that this has given us another chance to act. I think we can all spout language about being equitable and anti-racist and Black Lives Matter, and those are really important things to say. And I am enthused that I am seeing society say those more than I've ever heard. But to be clear, saying things are not enough. It's where do you put your time? Where do you elevate voices? Where do you invest your money or donate? And giving us a chance to, put our money where our mouth is, maybe not money, but time or voice, has been really powerful. And I think it's something that we are able to do because we are all nimble and relatively non-hierarchical organizations.
Yeah.
But it forces us to kind of take that step further,
Yeah.
which has been good, honestly, and needed.
Yeah. Dorothy, did you want to add anything?
Yeah, no, and I was going to say, I mean, I think the thing about a non-hierarchical organization in general is that you have a lot more accountability to the people that sort of help you lead this. And I think I've been impressed by the different dialogues that have been happening. Myself as an African-American woman, I personally, feel the effects of what's been happening in my own family. There's been some deep conversations with my 11-year-old about, how her dad looks and how he looks like someone who just got killed and what that could mean for our family. And that's been a really tough week for us. But I think with that, I understand that, now we have this opportunity to have, a deeper dialogue, and that, there is, to Megan's point, there's action that's actually happening. And so I think we can consider in each of our spheres, what can we do? What does that look like? And that may look like, do we support Black makers, right? Like, do we think about makers that are making within our community, that already are making masks or doing things, and how do we support the work that they're doing? How do we elevate the work that they're doing? How are we supporting the protesters? To Megan's point, I know GetUsPPE this week, actually today, we just released a grant for a very small grant for makers that are making PPE for protesters in particular. And so, exactly. So it's really exciting, but there are opportunities to actually use our platform, even if it's only a small step, right, to do the thing that's right. And I think that all of this, I think in some ways, COVID taught us that we could work together on really, really big problems. And I said this a little bit at NomCon too, but this is our next problem. And it's not really our next problem because this problem pre-existed COVID, right? Yeah. So in some ways it's our old problem we just didn't listen to, and now it's back again. But I think, we have an opportunity. And I think the thing that we learned from this is that if we actually work together, we can tackle big things. And it's not that it's going to be easy. It's not that it's going to be fast, right? Like we thought it might be 2 weeks, and now we're 3 months in, and it's probably going to be another 3 months, and maybe another 3 months after that. But no. But I think the reality is, the things that are hard take time. But the thing that's actually made the last 3 months bearable, at least for me personally, and the reason why I still get up and get on Slack, even though it's not my day job, right, is that I love to do it with the people that I'm doing it with, and that I realize that we can do this together, and I see movement that's happening, and an effect, a tremendous effect on our world, our local communities, and our globe.
Yeah.
So.
Well, I like your idea that the work is hard. I think even the people that have been doing the PPE work recognize that it's hard, but it's worth doing. And it isn't always that you get to the end of it. In a lot of tough problems, you have to work away at them, and you don't solve them, but you make progress. So I think that's a really good point. Let me ask you I have a question or two from the audience, but Megan, you were working on some of the HEROES Act, as advocacy work is. Can you talk a little bit about that?
Absolutely. So we actually have a whole advocacy team within GetUsPPE. Val Griffith and Desiree Shayer run that. So I want to give them the credit for really, again, as this organization that we're all doing our parts. They've just done unbelievable work in creating connections and helping our voices to be heard as to the needs of frontline healthcare providers. The HEROES Act, it was a number of discussions with senators and representatives on both sides of the aisle. And then creating spaces for our larger community's voices to be heard. Just before kind of the last week and a half, we were about to start a series of Facebook Lives with senators to talk more about the HEROES Act. Was great, but to talk more about kind of what needs to come next, because it was necessary but not sufficient, and there's still more that needs to be done. So there's so much more work to come.
Yeah. Okay, well, good. Let me just read a question. from Miguel Fernandez Rodriguez via YouTube. He says it would be nice if we had universities and hospitals check the huge variety of K95 arriving in our countries. And I think he's talking about the quality and whether they're actually effective masks. Testing has been a big gap and a really difficult thing to for the maker community to solve, to understand what the tests are or where to get things tested, and obviously for the medical community of receiving things that are not have not been tested or vetted. But there is this idea that once everybody starts saying it's an N95 mask, how do we know that it is an N95 mask? And this is comes from cloning and other kinds of issues that we see out there. Any thoughts on that?
Yeah, I mean, from my perspective, from the kind of healthcare provider, many of our hospitals are testing any kind of large, testing segments of large batches that they get in.
Okay,
and certainly,
good.
we saw the FDA guidance to not buy certain brands of KN95s. There was a period of time where we weren't allowed to import them at all, and now they're saying certain brands are not okay. I do think testing is critical. The trouble is, of course, a large hospital system like mine can test a percentage of a shipment.
Exactly.
Nursing homes and skilled nursing facilities will never be able to do that. So it does strike me as ironic that people say they don't want to use maker goods because of quality, but then we're using KN95s, which are known to have huge quality deficiencies and which are being made with some of them really with profiteering in mind.
Right.
Makers goods are being made
right.
for the opposite reason.
Well, it also, this is kind of going back to the open source idea in some ways, is actually knowing how things are made, the provenance of them, where they're made and how they're made is part of how we know to trust them or not. And it isn't say that things made in China are bad. It's just that there are toy factories making masks now that really didn't know how to make them. So we have those kind of issues. Well, listen, I'll repeat Tobias Dema, if I said that right. He said, thank you for the great panel, everyone. I'm so glad this is happening. Thank you all for being a part of this program today and sharing what you're doing. It's so fascinating to learn more about it and to hear from you directly. I hope it, again, to echo in this, you're mostly, if not all, volunteer-based organizations. So you all have day jobs to do other things. So this is really a tremendous amount of work that people have signed up for and very much helping us through a very difficult time. So thank you all very much.
Thank you for being on.
Thank you for having us.
All
Yeah,
right.
and if anyone's interested, please do head over to FindTheMasks. We definitely would love to have any maker groups on the FindTheMakers map. And if you're looking for a place to donate, you can find lots of places to donate at FindTheMasks, and same for GetUsPPE. We also are able to connect folks through GetUsPPE, and then GetUsPPE also has a repository of designs as well as some granting opportunities for makers in particular. So head over to both of those organizations' websites. If you're a maker, there's definitely a place for you in both organizations. And we're just so grateful for all the work that you guys are doing on the ground. We know that you're tired, but please keep up the good work, and we'll continue to try to do our best to support you in all that you do. Thank you.
Yeah, our next Plan C Live program is Thursday. It's on Fix It Yourself, Repair in a Time of Pandemic. So please join us there. Albert, do you have a thought?
Just last call out that, so one thing that we have on FindTheMask side is a bunch of really good website developers. So if you end up having a situation where you just can't be efficient because you can't solve a technical problem, drop into our channel and consult with us. We will happily make things simple. That's what our job is.
Be careful what you wish for.
Fix the website.
The more people there, the more we'll have.
Yeah. All right. Thank you all very much for your time today. Thank you for changing the schedules and stuff. I appreciate it.